if there's no history of cancer in my family, what's just my general risk of getting breast cancer?
That's about the population risk that currently is about 10 to 11%. So 10 to 11 women out of 100 women. It's pretty high. It's the most common cancer amongst women.
And remember that slide that Diana showed that most women with breast cancer do not have a very strong family history of breast cancer. Okay. In the booklet, you mentioned developing a web-based risk assessment questionnaire. How do we do that? Is that free?
So right now we have just started using, when someone makes a genetic counseling appointment, they are actually invited to go online and input information about their family tree ahead of time, so we can take a look at their family tree before they come for their appointment and are able to kind of prepare and see what do we need to talk about with this family. And so that's all online right now. Does that answer the question?
Yeah. So basically the pedigree, for example, Diana showed, we are not asking you to draw a pedigree and do all of it, but it is very important for us that we have some material to know and work with when you all come to our appointments. So this interactive website has drop-down menus where you enter yourself, your first-degree relatives, mother, father, aunts and uncles with different type of cancers, age of diagnosis, and what this computer program does, it populates it and draws the pedigrees for you, and you can print it out, bring it to us, or it stays there, and then when you meet our counselors, then they will open it, and you together will go through the individuals and edit during the counseling sessions, then you have a final pedigree. That is recently we have found is very helpful for all of us, actually, you and as well as us.
Yeah, I think it's very important to know if you're coming in to talk about your family history, it's just a good prompt for you to call your relatives, call that one aunt that knows everything about everybody in your family, so you can bring that information instead of coming to the appointment and saying, you know, I should call somebody, and it helps prepare you ahead of time.
Go ahead.
Yeah, this is really a hypothetical question, even though I'll use my own family as an example. But two preeminent breast geneticists, one from MD Anderson, not here today, have told me, I'm a breast cancer survivor long term, have told me that my family history does not warrant any BRCA testing. So I've not had it. However, I continue to be worried because thinking logically, it's occurred to me, I've thought many times, that BRCA gene has to arise at some point in some family history. How do I know that I'm not the first woman in my huge family history, which these docs have seen, to have acquired this BRCA gene, and therefore my 3 young daughters are all going to be at risk, and I'm being told by the 2 preeminent geneticists not to worry?
That's a good question. It makes sense, but as far as we know right now, these BRCA genes have to be inherited from your mother or your father. Some genes that aren't the BRCA genes can change for the first time in an individual, but we haven't seen that in someone with a BRCA gene. I know it started somewhere way up in your ancestors, but we haven't seen that happen. Usually what I tell patients when they ask me that same question is that if by chance, you do the testing and we find that and neither side of your family has the BRCA gene, you're going to have a paper written about you. Yeah. It's slim to none chance of that happening.
But that's true for this one. But there are other genes. We know that what we call there can be a de novo mutation, like it can happen in that individual at that generation. But the likelihood for the BRCA is almost 0. Yeah. The P53, for example. Mm-hmm. But then you also have to have a very suggestive family history or very young
personal history too.
Personal, very, very young onset of breast cancer and multiple other cancers.
And I would just caution us to remember that these BRCA genes only account for 5% of the breast cancers. So having breast cancer and testing and not finding a BRCA gene does not mean that your children or your daughters are not at increased risk. Your daughters are at increased risk, but not likely because of this gene. Okay, so that is one thing I do see people get confused about. They think, oh, I tested negative, so my family's not at risk. That is absolutely not the purpose of the BRCA gene when it's uninformative.
When they're gynecologists in their 20s, they are told you are at increased risk of breast cancer because your mom had it.
Correct.
And that is true.
That's because why? We don't think I have BRCA gene.
Because there are other factors in your gene that, when put together, can increase the risk, and that can range from 2-fold to 3-fold to 4-fold. We don't know. The reason why we know this, because we know we have families where there is no BRCA mutation, but generations have cancer without having the mutation, so it's something else. Or it's a interaction of the genes with the environment, and some daughters have it, some don't. And that's what I mentioned of the negative results, where it's very hard to calculate the 20% lifetime risk to do MRIs, for example.
So it could be some as yet undiscovered.
Yes.
That doctors, researchers don't know about.
Yeah.
Mm-hmm.
And
go ahead.
when they're saying that your daughters are at a higher risk, they're not saying that they're at the 80-something% risk that a BRCA mutation has. It might just be a few percent higher than the general population.
So let me end with this question, because I think that this is a very important point. What is your advice about doing genetic testing with or without genetic counseling?
I'm biased because I'm a genetic counselor. So I think that there are physicians and nurses that are in the community that are very capable and knowledgeable about genetic testing. However, we do see sometimes people come in and they lay their positive test result down on the table and they say, I don't know what this means. Their doctor just drew their blood and handed them the test result and said, go to MD Anderson or go here, and those sorts of things. So I think it's important for such, the BRCA genes are rare in the general population. So I think it's important when you have something rare that you find a specialist that knows all about them. But I am biased, but it's very tough for us to see someone come in that says, I don't know what this means, or they've had the result for a couple years and haven't done screening yet, those sorts of things.
That is the most scary thing. Oh, I think I had this testing. We've had patients where we did a 1-hour counseling and then, oh, I think I had it, or my sister had it 2-3 years ago and it was positive. Nobody knew, no MRI, no ovarian screening, nothing. It doesn't happen all the time, but it happens.
And certainly it's also nice because a negative result, when you say, oh, we didn't find any changes in your BRCA genes, you're negative, that sounds great right away. But if we do look at your family tree and see that it's full of many different types of cancers, we might need to do increased screening for you, or we might need to test another different gene.